Hey guys, this is Shruti DeRay from THB here at Dallas, Texas. And in honor of Breast Cancer Awareness Month, we had the amazing opportunity to talk to Dr. Alex Sardiña for our October issue. Dr. Sardina is the Chief Medical Officer of Solis Mammography, and who better to talk about breast cancer awareness with than a breast specialized radiologist? Solis Mammography has over 70 centers across the nation and has performed more than 5 million procedures. With Solis Mammography, Dr. Sardina guides hundreds of specialized radiologists across the nation to provide women the state-of-the-art screening and diagnostic experience designed to give them a peace of mind. Dr. Sardina is going to be answering some of our questions today, so let's get to it. So I want to start off by thanking you for being here with us today. Our magazine focuses on spreading awareness about healthcare delivery, specifically mother's health, in developing countries and providing a platform for the youth to find guidance and voice their opinions. With October being Breast Cancer Awareness Month, we thought it'd be the best time to shed some light on the topic with your help.
Absolutely.
Awesome. So with the recent increase in social media presence, more people all over the world know about breast cancer and its effect. However, for those who do not, would you be able to shed some light on the importance of breast cancer awareness?
Yeah, so I think it's probably a good idea to kind of give a context of just breast cancer in general. As you pointed out, it's a global disease. In the United States, it's the second leading cause of cancer-related deaths in women. 1 out of every 8 women will develop breast cancer in their lifetime, and that number is up from when I started in medicine. When I started, it was 1 in 12. So the incidence and the prevalence of breast cancer has gone up over the last 25 years. So it's a global disease. Fortunately, though, the silver lining, if there is one, is that when detected early, breast cancer can be extremely curable. So one of the things that I commonly say when I'm doing presentations or speeches, breast cancer is not preventable, but breast cancer is highly curable. And that's important to know, right? Because a lot of women that are diagnosed with breast cancer, when I'm having that dialogue with them, the first thing that comes out of their mouth a lot of the times is, what could I have done differently? Mm-hmm. Almost like, how did I bring this onto myself? And what I like to tell them is, you did nothing wrong, right? There's nothing that you could have done differently. Some of it could be genetically predisposition, but most of it is not. And it's not a lifestyle, choice or option that made you develop breast cancer. But when detected early, it's extremely curable. And that's why we're always promoting breast cancer awareness, so that women go out and get their mammograms, which is the only real way to know whether or not you have breast cancer. So from that perspective, that's why I think at least having 1 month out of the year that we focus awareness on breast cancer is important, but it's also important to remember it's not a seasonal disease, right?
Is there?
We only diagnose breast cancer in October. Now, we're raising awareness, but awareness really should be year-round.
Mm-hmm. Of course. So talking about prevention and treatment, in the span of your career, how have you seen breast cancer diagnosis and treatment methods improve?
That's a great question. So I'm going to be dating myself here a little bit. When I first started in radiology, we still had the old black and white films for mammograms, just like we do for chest x-rays. And that method was around for almost 40 years. And in around 2001, we switched over to what we call 2D digital mammography. So we did away with the hard copies, and now we were able to interpret mammograms on a screen. And within 10 years, we went from 2D to 3D. So It took 40 years to go from plain films to digital. It only took 10 years to go from 2D to 3D. And in the last 5 years, we have gone to higher resolution 3D. We're talking about contrast enhanced mammography. We brought on MR as a way of diagnosing breast cancer in a select field of women. So the diagnostic part of it has advanced tremendously, and so have the treatment options. We have developed treatment regimens that are very, very specific to the type of breast cancer that you have. So now we do a lot of genetic typing of the breast cancer and then have targeted treatment for that particular subtype of cancer. So it's come a long way, and I would predict that the advancements will continue exponentially in the few years ahead of us. So it may be completely different when you become a breast imager or an oncologist.
Awesome. That's crazy. It's like, just as technology is advancing, I think in this world right now, everything is just exponentially getting better or improving or becoming faster and everything. It's crazy.
Absolutely. I mean, just when I started, we had, single CAT scans. Then we went to CAT scans that had 4 detectors. Then it went to 16. Then it went to 32. We're now at 128. I mean, it's just, there's no insight. So that's the fun part of radiology. It's always changing. It's always getting better, probably more so than a lot of other specialties.
Of course. So talking about technology, how has like AI, artificial intelligence type, machine learning and gene therapy impact like the future of breast cancer? Like, how do you think it will impact the future of breast cancer?
That's an excellent question. So one of the fun things about the job that I'm in and being at Solis is that we invest in future technology. And a lot of the times we help kind of develop it. But we're looking at several AI products now that are going to be revolutionary, right? So we've got machine learning now that can help me as a radiologist look at the 3D images and tell me, hey, you should really look at this area a little closer, because based on the AI, this kind of change in the breast could be cancerous. But not only are we there, we're kind of moving towards what we're calling autonomous reading, where the AI will actually read the mammogram and make a determination of there's absolutely nothing here, and give the patient the report almost immediately, which kind of minimizes my role to a certain extent, but it's a much better way ultimately of reading the study. We're also looking at AI technology that looks at a mammogram and tells you what your likelihood of developing breast cancer in the next 2 years might be.
Oh, wow.
Not only helping me read it right now, it's also helping me predict what the future might look like over the next 12 to 24 months. So AI is here to stay. So it's better for us to embrace it, kind of help guide it in what we think might be the best way, adopt it, and help perfect it. So it's having a huge impact, especially in radiology.
That's awesome. So now I'm trying to switch the lens a little bit about those who maybe might not have access to all this technology, such as those in like underserved or under-resourced communities. How do you think they can approach breast health, like if they were to be diagnosed with breast cancer or someone around them?
So the first part of that question, I think, should be around detection, right? Mm-hmm. How does the underserved community facilitate breast cancer detection? And one of the things is, if you don't have access to the imaging modality, maybe not as frequently as those that are, more fortunate to live in a bigger city or socioeconomically, more likely to be able to get a study because of insurance, there is a place for education and self-awareness and performing self-breast exams, right? So one of the things that I encourage all women is do monthly self-breast exams, get to know your breast, get to know the architecture, the lumpy bumpiness, so that if there is a change, it kind of should raise your awareness of, I should maybe make a stronger effort to go out and get that mammogram. So, and that's across the board, but really in the underserved community, kind of self-awareness and self-education is key. The other thing is getting to understand what programs are available. There are several programs at the national level and the state level that actually pay for screening mammograms in the underserved communities. It's just a matter of knowing that the program exists and enrolling in it. And one of my passions, and I'm actually not a breast imager by trade. I'm a radiologist, but I focused on orthopedic radiology and body imaging. But one of the things that kind of got me into breast imaging is exactly around that question, where I was sitting in a community hospital in suburbia, and I had a young lady of 78 years old literally drive 140 miles round trip to get her mammogram.
Wow.
And I asked her why, and she's like, well, you at the time, she's like, you have the best 2D technology. And I'm like, but don't you have, similar technology where you're at? Don't you have a hospital nearby? She's like, the nearest hospital is 20 miles from where I live, and they only have, the old film screen technology. So there was no access. So one of the things, what really kind of got me going in this path was mobile imaging. How could I put the technology of today and make it accessible to rural communities or underserved communities? So that is kind of a passion of mine. And I think we probably need to do a little better job getting the technology that we have in the big cities and mobilizing it and getting it out to rural America where they don't have access to that level of technology, don't have access to dedicated breast imagers. And I think we can do that, and we can be more mindful about doing it.
Of course. And for those who are hesitant right now because of the pandemic and COVID, and like they don't want to get into medical buildings or like overexpose themselves to COVID, what advice would you have for them? Should they come in anyways, or like how should they approach their fear?
So I think the antidote for fear is knowledge. It's education, right? So I am not encouraging anyone to come in without understanding what safety measures have been implemented, right? So at Solis, we've been very mindful about implementing safety measures that not only meet, but exceed the standards put forth by the CDC. So when you come to our facility, you will be asked several screening questions to make sure that you have not been exposed or potentially exposed. We'll take your temperature. So if you've got an elevated temperature, you can't come in. Then we have implemented very strict cleaning measures. So we clean anything that is touched by a patient, right? From the pen to the countertop to the gantry. And then we do an extremely thorough cleaning of the facility every 2 hours. All of our technologists and all of our physicians get screened the same way. And they're all required to wear gloves, masks, and goggles. So we have an environment that we feel very, very comfortable in being able to open our doors. So what I would tell your listeners is don't hesitate on getting your mammogram, but make sure that wherever you're going to have your mammogram, they have safety measures that meet your expectations.
Of course. Awesome. Thank you so much. I think we've gotten through all of our questions for today. Thank you for taking the time. Do you have any questions for us about our organization or anything?
Now, why don't you tell me a little bit about your organization? I think I was intrigued by it, and when it came across my desk, I was very kind of excited about participating, but it'd be nice for you to tell me a little bit about it.
Awesome. So we are a nonprofit organization, and we focus on delivering like mother's health and neonatal health. Specifically, we started in India, but now we're just slowly trying to spread everywhere where we know we have members. Some members are moving to other countries and they're interested in helping us. But we basically try in India, what we've done so far is before COVID, we had a few projects that had us get involved with the communities, the underserved communities in India, various states in India. And we had little clinics that educated mothers about pregnancy and other such women's health. And then we had also clinics where neonatologists from America would come over and just help and talk to the people living in underserved communities and just, again, giving them some exposure to what mother's health is and how to improve the health care that they were receiving.
Oh, that's very much needed. And I think we share something similar. I think what you're doing, I think education goes a long way.
Yeah.
Right? Preventative education, understanding how to prevent something from happening, but at least educating yourself as far as when it happens, what are the signs of early detection so that you can address the problem, have a much higher likelihood of success than waiting until it's too late. So very noble and very admirable.
Thank you. Yeah, I think the biggest problem is like a lot of people don't know. And I think that's where the biggest problem is, just because people don't know what they they should be doing or what they could have done. And since that's how like most of the problems are arising. And I guess just giving them a little bit of knowledge or background, it goes a long way because they keep the information with them.
Absolutely, could not agree anymore. And good luck in your future
Thank
endeavors.
you so much. Have a great day, and thank you to your whole team for staying so in touch with me and trying to iron out all the details. That was really, really helpful.
And we have a great team. So it was my pleasure. I'm sure it was their pleasure. And anything else that we can do for you and your organization in the future, just let us know.
Thank you so much.
All right. Have a great one. Take care.
You too. Goodbye.